So why don't we start with the pre-brief. Colleen is going to tell us about, I think, no pressure, the most important part of this whole thing. Because the answer to many of these difficult learners is, well, if you'd set it up right in the first place, you wouldn't have this problem. But it should be live.
Okay, is this on? Okay. So, and how do I guess I'll advance the slide.
Oh, here. I got to click here. Sorry. I should give that to you, shouldn't I?
Thanks. Okay. So, so this is a course about debriefing, but I'm going to talk to you briefly about pre-briefing because you want to start right to end right. Great. So the first thing is, really with the entire simulation, your goal, I think, should be to create a safe container for your learners. And the first way to start that is to give them a sense of what they're in for. And so that's to start with a good pre-brief. And there are really 4 main aspects of that. And all of this really is to show your learner that you have respect for them. But you want to have a thoughtful welcome. So that's what we all just had, was a thoughtful welcome. Most of our sim talks we try to model on this pre-brief. And then you want to create a transparent learning process so that your learner knows what to expect as they go through the simulation in the day. So just like Dr. Strother set out for you, we're going to divide you into 2 groups, and here's what we're going to do. And then finally, you really want to set up this fiction contract with your learner. And we'll talk a little bit more about that as we go through. So thoughtful welcome is pretty obvious, right? Introduce yourself. Let your learners introduce themselves. Tell them what to expect for the day. Review your objectives. Now, review your objectives can be kind of broad if you don't want to give away your case. So it can be, we're going to learn some medicine today. Or it can be a little more specific if, for example, you're working with a team of interdisciplinary learners and you really want everyone to know, to start off with, that you're really focusing today on communication and teamwork. So while there will be medical decisions being made, please don't worry about that. Focus on your communication and teamwork. So it depends a little bit on the objective of your simulation, but it's still important to have some sense of an objective for your learners. And so then this gets to, I think the basic assumption is really the most important part of the pre-brief. And this really gets to showing respect for your learners. I say to my learners in every pre-brief that I am assuming that you're intelligent, that you're here to do your best, that you are capable, and that you care about your education. The reason I say that is twofold. One, it puts me in the frame of mind that I'm holding this assumption. And when we talk about some of the debriefing things later, when you hold this, you'll see that it helps, holding this assumption helps you maintain curiosity so that you can get to the context of your learner and not make assumptions about where they're coming from. And it also helps you be kind to them when you give them feedback if you have held this in your mind. And on the flip side, if the learner knows that you are expecting them to rise to this level and to treat the simulation as if they are capable and intelligent and want to do their best, then you get a better performance out of them and you show them that you respect them. And it helps them live in the growth mindset rather than in a fixed mindset. And if they have this basic assumption about themselves. And so I don't know if, I'm pretty sure most people in here have heard of growth versus fixed mindset, but our goal in the simulation is to give our learners the room and the space and the safety to make mistakes, to try out different strategies for teamwork or for communication in a way that is safe, and to embrace that awkward feeling of being on the edge of maybe not quite knowing what to do. And they can only really do this well if they feel that they're respected and they can really inhabit the space of being in a growth mindset. And then finally, this transparent, not quite finally, penultimate is the transparent learning process. And that's really pretty self-explanatory. Maybe you need to talk about physical safety because you have a standardized patient that's a human, and you just want to say, P.S., don't hurt the human. Don't put an IV in them. Don't take their bra off. Keep in mind that they're acting this role for you. Maybe you're doing an in situ simulation in the hospital setting, and just in case you have a real mass casualty incident, you need a code word for this is not a simulation anymore. That's important sometimes to set up ahead of time. And then confidentiality, I always say in my pre-brief, what happens in simulation stays in simulation. Also, this is important for two things. One, it creates that safe space for learners to be more openly reflective about the way that they're behaving and interacting and what their influences are. It enhances the conversation so you have a more robust learning experience, but also it makes it so that you can reuse your simulation when you have a new group of learners because they haven't all talked about it and given away all the details. There's some controversy about traps in simulation and whether it's okay to insert traps and tricks into your sims. I think that it's only okay if it serves your objectives. If your objective is to have your learner practice discussing a death with a family member, then by all means have your simulated model die so that your learner can practice that. But it's not okay to throw a trick in just to trick the learner. That undermines the safety and the respect that you've tried so hard to build to get them to participate actively in the simulation. Video, just address it. If you want a video, do videos. If you don't. I don't like them, but some people love them. But your learners need to know that they're being videoed, that you're going to save the video, that you're going to delete it, so that they can just have some comfort in what's happening in the session. And then I also, especially for interdisciplinary simulations, always like to address scope of practice. I think it's important to say, we're only expecting you to be you. I'm not expecting a nurse to be a doctor. I'm not expecting an anesthesiologist to be a surgeon. I want you to practice in the role that you usually practice in. And sometimes this needs to be said ahead of time so that people feel comfortable with all the rest of the awkwardness, because it is awkward. And so finally, this fiction contract, this also really, it's important for everybody, but it's really important for those learners that have a difficult time suspending disbelief. They need to hear that you know it's a simulation, that it's not real. And in recognizing that, they also need to hear that you are respecting them by doing your best to make the simulation as real as possible within the confines of the environment that you're in. And then you just ask them to please suspend disbelief to the extent that they're able, because that is going to make this use of their time more fruitful. And if you can get them to agree to that, then that's the best that you can do, and they're hopefully going to do the best that they can do. So in summary, end well by starting well, help create a safe container, be transparent, respect your learner, teach them the basic assumption and hold that for yourself, and enlist them in this fiction contract. And that's it. And really the pre-brief takes maybe 2 minutes to go through. But it's so important for a good debrief. And I don't know who's next. That's the end of my slides.
Any questions?
Questions for me? Yeah.
I think in this day and age when we do simulation, and there is assessment simulation and non-assessment simulation. Some people do it, some don't. I'm not going to judge. I do assessment. I think part of the transparency is you have to be completely and utterly honest up front about that. This simulation is not, I am not assessing you when I do this simulation.
Yeah.
And because one of the things that was really instructive to me was when I took over our simulation program, we gave the residents a lecture every year, and I added that none of this goes towards your evaluation. And none of them knew this. Not one of my residents in the 5 years of us running simulation had actually asked us about it, and they all thought they were being evaluated by us when we did sim, and what happened in sim was going to our residency leadership. So I would be really clear about that. I think it's great to use it for assessment if you do it right, but you have to be 100% transparent and honest about it.
Yeah, that's a very good addition.
Can I add to what Mike is saying? I don't think I need a mic. People can hear me. I think, oh, you're recording.
They record this, yeah.
I don't know if they want to record my voice.
I got it. I got it.
I was just going to say, I think going back to assessment, just for the APDs that are in the room that also do SIM, do you guys talk a little bit about psychological safety in the context of assessment? Because we do that in our course. You know, you guys are their program directors, and you're doing simulation, and you're supposed to do it for their learning and teaching. But then you say, oh, in simulation, it's a safe space, you can do whatever you want. But we're your APDs, so guess what? We're watching you all the time, which is the truth. I mean, that's the context of you guys helping them to become better clinicians. But I think that becomes a little bit of a conflict of interest sometimes that we've run into. I don't know if you guys
I actually specifically often will address that and just say to them, I really appreciate that you brought that up, Mike, because I think it's really important to say this simulation is an evaluation, if it is an evaluation. And then, Ambrose, to your point, I always try to say, you know, as your APD, I am not evaluating you during this simulation. That being said, I can't take out of my head what I see here, right? If I notice that there's some issue that really needs to be addressed, I will address it with you on your own, separately from this, and I want you to think of it as an opportunity that's been opened up for me to help you learn better and be a better doctor, because that is my entire goal with the simulation. I mean, and I do say none of this will show up in any written evaluation of you, and sometimes in other cases I've said, you know, for example, if the program director comes and asks me how is so-and-so doing in simulation, my response to them will be, they seem to enjoy it. I try to make it as I guess, what's the word?
Evaluative, yeah.
Yeah, non-threatening as possible, yeah.
You had a question?
I work with the same learners throughout the year. Do I need to go through this whole pre-brief process, time number 6 that I've met with them? Like, it's the same situation. Can I truncate?
Good question. There are parts that I truncate. However, I always say the basic assumption. I always repeat the fiction contract. I always welcome them. And I may say, I know you've been here before, so I'm going over this again, but I'm going over these things because I think they're so important for us to remember. I also always say what happens in sim stays in sim. I think it's important to remind them of those things. I just do it shorter.
Yeah, they've heard it before.
Yeah.
I mean, every now and again, someone does something just mind-boggling in a simulation, and if I have a reminder, I'm like, what?
Any other questions from you guys? No. Okay.
Miriam, you had something to say?
I was just going to kind of go back to that point about, so I'm the program director. I did SIM for a long time as an APD, and now I'm the program director, and it adds a whole new level. And I think, you know, and if I don't do it, there's no one else in my institution who's qualified to do it. So really, it's I do it or it doesn't happen. And I think it's real, if you find yourself in that leadership role and you're doing SIM, I think it is really important to be very careful about that safe space and to re-emphasize it. I think it's really important to not sit down with them at their biannual evaluation and be like, so in the SIM, you know how you killed 5 patients? Like, I think the time to talk about that is in the SIM. But I also think that if you are going to be in program leadership, right, it has to be okay for your learners to make mistakes around you, right? Because if they can't make mistakes and can't talk about their mistakes and don't feel comfortable enough with you to be vulnerable like that, it's going to be really hard for you to teach them. And that's why I don't think that those two things are mutually exclusive. I think you just have to be a little bit more careful.
And you have to be upfront about it and open about it.